As we have now developed these new treatments for hepatitis C and potentially cure rates as high as 90%, it's important to bring into treatment those patients who have yet to be diagnosed. They represent in the US about 50% of the overall pool of patients with hepatitis C, which may be as large as 1.5 million to 2 million patients. To get to these patients, we need to improve our screening from what we've traditionally done, which has been risk factor-based screening, where we look for risk factors of hepatitis C and then screen the patients, to screening that can identify patients at an increased risk for issues other than simple risk factors. How are we planning to do this is by screening those patients who were born in the baby boomer generation. In the US, the baby boomers were born between 1945 and 1965. Data from the NHANES study has suggested that this age group is enriched in hepatitis C and that up to 3% of these patients may have been exposed to the HCV virus. Thus, if we target these patients, what we can do is enrich the pickup rate of undiagnosed patients with hepatitis C. In addition, moving from a risk factor-based screening program to a simple baby boomer-based screening program helps us because it destigmatizes hepatitis C to some extent. And so we're just really doing this age-based screening. Now, this is a recommendation that has been put forward by the Centers for Disease Control. It's also been accepted as a Category B screening program by the Public Health Service. That means that it's actually reimbursed in the United States to screen these patients. So everything is laid to increase diagnosis of hepatitis C patients, but we have a problem. And that problem is, how are we going to implement this? What has been recommended is a simple once-off hepatitis C antibody test. This is a relatively cheap test and easily done when a patient attends his primary care physician for his annual screening visit. So the idea is to incorporate the Hep C screening at the primary care level into patients who are being seen on an annual basis and simply do a once-off single antibody test for hepatitis C. Sounds easy, not so easy to actually put into place. There are multiple new programs using things like electronic medical record prompts and doing education of primary care physicians to try to enhance screening. We have implemented the screening program for approximately 10 months now at the Beth Israel Deaconess Medical Center where I work, and we have seen our screening rates go up significantly in the baby boomer population. And we are screening somewhere around 2,500 patients a month for hepatitis C, and our pickup rate is about 1.5, 1.6%. So we are seeing some benefit to this education baby boomer prompted screening program, but we have a long way to go if we're actually going to identify all these potential 1.5 million undiagnosed baby boomer patients.